Hello, this is Dr. Mazhar Hussain from DMH Functional Medicine. We are going to talk about the role of zinc in thyroid health. And of course, this is no substitute for personalized, individualized medical advice. This is purely for informational and educational purposes. So you need to speak to your doctor if you are having any issues with your health, including the thyroid. So zinc has some direct impact on the thyroid health, and it has some indirect impacts. But before we get to start, I'll just give you a very brief overview of the thyroid hormone production. So the pituitary is stimulated from the hypothalamus through a hormone called thyroid releasing hormone. It travels to the pituitary, where the pituitary can then release thyroid stimulating hormone, and it works on the thyroid hormone to produce T4 and T3. So T4 is 80% of the production and 20% is T3. T4 is the inactive form. It travels through the blood to the various tissues and is converted to T3, which is the active form. And the T4 to T3 conversion happens around 60% in the liver, 20% in the kidneys, 20% around 20% in the muscles, and the remaining 1-2% in other tissues. But this is the active thyroid hormone. This is inactive, and reverse T3 is kind of a brake on the metabolism. It sits on the same side that the T3 hormone does, but it doesn't have the metabolic effects that T3 has, so it's kind of a brake. So zinc can impact on the regulation and the release of thyroid stimulating hormone from the pituitary. So it starts already at that stage, but then it's also involved in the production of T4 and T3, and it's also involved in the conversion of T4 to T3 and the cellular sensitivity to thyroid hormone. So T3 works on the nuclear membrane of the cell, and it attaches to its receptor there. For that process to take place, we still need the presence of zinc. So zinc is actually involved in all of these 4 stages: in the production of thyroid stimulating hormone at the pituitary, the production of thyroid hormones, the conversion of thyroid hormones, and finally the cellular sensitivity to the thyroid hormone. If you're lacking zinc, any of these processes can be affected. And even if you have sufficient amount of T3, all of this is working. But if on the cellular level in the end tissue, in the target tissue, there is some zinc deficiency, you may not have the full impact of T3 hormones. It's important to remember, so whenever I talk about a certain micronutrients in a certain specific way, you may think, well, okay, then I just need to go and buy zinc. But if you're lacking selenium, if you're lacking vitamin D, if you're lacking vitamin A, if you have B2 deficiency, B3, B6, B12 deficiency, if you have iron deficiency, iodine deficiency, well, it's not just zinc that is required. There are many other factors required to be able to produce thyroid hormones. We also then have some indirect roles for zinc in thyroid health. So zinc is very important for our immune system, and if our immune system is not working optimally, it can increase the risk of Hashimoto's. So zinc deficiency has been linked to an increased risk of developing Hashimoto's. Keep in mind, Hashimoto's is an autoimmune disease where the body's own immune system starts attacking the thyroid gland, particularly to its antibodies against thyroid peroxidase and antibodies against thyroglobulin. So zinc deficiency is linked to an increased risk of Hashimoto's. Apart from that, zinc is also very important. It has antioxidant properties, and it also protects the thyroid gland against oxidative stress. So zinc is really important for thyroid health. If you are hypothyroid, it is, if you are suffering from autoimmune Hashimoto's, it is worth always to check for whether you're zinc deficient. There are quite a few number of people that are not zinc sufficient, and it can impact not just the thyroid gland, it's also important for overall thyroid health and overall body health. The immune system requires zinc, and there are many more reactions where you need zinc. It's also important for your hair, it's important for your fertility, and there's so many reasons why you wouldn't want to be zinc deficient. So, and one of those reasons are your thyroid health. This was a very brief presentation of the role of zinc in thyroid health. I hope you liked the video. Do give us a thumbs up, share it with your friends and family. Hypothyroidism is very common. According to some estimates, maybe 1 in 5 women are suffering from hypothyroidism. It could be due to zinc, it could be due to other factors. Speak to your doctor about it. But it's very common, and chances are friends and family would have some in your network would have hypothyroidism, and they could also be zinc deficient. Subscribe to our channel and click the notification bell so that you get updates as we bring in a new video. Thank you for watching, and see you in the next video.